everyone. Thank you for joining us here. Today, I'm pleased to provide you with highlights of the 2023-2024 budget allocation for the Ministry of Health. The Ministry of Health comprises 4 departments, namely the Ministry of Health Headquarters, which includes the Office of the Chief Medical Officer, the Department of Health, and the Health Insurance Department, and the hospitals. The Ministry of Health's vision is to ensure healthy people in healthy communities. The budget of $199,240,106 for the 2023-2024 financial year includes $155,158,762 in funding for King Edward Memorial Hospital and the Mid-Atlantic Wellness Institute. This represents an overall increase of $4,740,095, or 2%, compared with the ministry's original budget allocation for 2022-2023. The Ministry of Health's estimated revenue for 2023-2024 is $55,000, and of course this is a substantial decrease compared to the 2022-2023, and this is due to the elimination of the travel authorization last November. The Bermuda Hospitals Board will receive $155,159,000, which represents an increase of $7,900,000 for operations in their 2023-2024, and this is compared to last year, 2022-2023. As noted by the Premier and the Minister of Finance last week in the budget statement, the government made a funding commitment of $322 million per year to BHB, and that was made over 4 years ago, and unfortunately did not meet that target. And this financial commitment will help to ensure the hospital is placed on a more sound financial footing. I'm also pleased to highlight that in this coming year, $700,000 of capital funding is being provided for building permit, construction drawings, and equipment purchases for the Mangrove Bay Clinic renovation. This facility will provide high-quality healthcare services for the community in the island's West End. The preparation will be undertaken in 2023-24 so that construction can commence early in 24-25 as the building permit is obtained and the contractor selected and confirmed through the official tendering processes. The services that are going to be included at well baby visits, including child immunization and healthy development checkups, physical therapy, occupational therapy, and speech-language pathology assessments and services, sexual and reproductive health services, adult wellness clinics, and integrated mental health services in partnership with MWI. Another critical program for the ministry is our transformation to the universal health coverage, which requires the strategic planning of upcoming projects and ongoing engagement with key stakeholders to ensure decisions and actions impacting UHC are patient-focused and timely. For this, there's an allocation in the ministry's quarter budget in the amount of $1,463,000, and this is solely designed to establish the Program Management Office for the delivery of universal health care, as well as a further $900,000 for consultants. The PMO, or Project Management Office, will manage the coordination, implementation, execution, and integration of all projects and associated work streams in the 2023-24 and beyond to help to accelerate change towards universal health coverage. The PMO will also support the transitional governance structure whose purpose is to facilitate the engagement of the many and wide-ranging health system participants through stakeholder working groups and forums. Also in the coming year, $100,000 of funding will be provided for the Barbara Ball Public Health Scholarship, which is awarded to Bermudian students with proven financial need seeking careers or professional development in public health. It is offered in honor of Dr. Barbara Bertha Ball, who was the first-born Bermudian woman to practice medicine in Bermuda and a tireless champion for people's rights. This scholarship covers a range of healthcare fields of study that directly benefit public health and are a priority to the public health needs here in Bermuda. The scholarship was last awarded in 2020 and was interrupted due to the demands of the pandemic. During the next fiscal year, funding has also been made available for the Department of Health and several collaborating primary care physicians to demonstrate that the HEARTS protocol locally and to harvest the learning before the protocol is rolled out and available to the entire health system. HEARTS in the Americas is a Pan-American Health Organization flagship initiative for providing and improving high blood pressure control and heart disease risk management in doctors' offices using a standardized treatment protocol. HEARTS has been implemented in 24 countries in the Americas and is a simple, practical, and easy-to-follow treatment protocol that can vastly improve and control high blood pressure. This program is in part of an allocation of $534,000 for health promotion and wellness. And finally, I am pleased that the government will extend customs duty exemptions for investments in plant and equipment to the personal fitness sector. Regular physical activity can help prevent various health issues such as diabetes, heart disease, and high blood pressure. And this duty relief will help our fitness facilities upgrade their equipment, which will benefit us all in our attempts of trying our best to keep healthy, active, and fit. The government's 2023-2024 budget provides a path to continued economic growth and supports the Ministry of Health's objectives and commitments to ensure healthy people in healthy communities. Thank you.
Thank you, Minister. We'll now take questions from the media. You want to start, Jasmine, from the broadcasting?
Good afternoon, Minister. Thank you for your comments. There was also mention in the budget about a medical tourism facility. If we can touch on that, how will this be funded, and how do you intend to attract specialists to the island?
Okay, thank you for that question, Jasmine. We all know that medical tourism is a very extremely competitive initiative in many jurisdictions, and Bermuda possibly can place itself in that industry. However, I would have to refer those particular questions to the Minister of Tourism as well as the Minister of Finance, who can provide you with more details. But what I can say from the Ministry of Health's perspective is that it is important for us to focus on high quality, necessary, efficient, and cost-effective health care for all of our citizens.
Okay. So there's going to be increased funding for KEMH and MWI. A $15 million grant will be provided. Given that more funding is being given, will there be more oversight on hospital services, including reducing wait times and closer staff review?
Thank you for that, Jasmine. As the Premier indicated last week, the grant that has been agreed to the hospital, the block grant, in this sum of $322 million since 2019 has never fully been fulfilled, and hence the Cabinet did approve a $15 million supplemental to help put the hospital on a better financial standing. However, as you'll also appreciate, that the hospital has a very dedicated and committed staff, as well as an executive and a board that oversee the operations of the hospital and deal with quality control, administration of services and the like. So I'm confident that the board will continue the high quality and expectations that the government has of that board.
Are you satisfied with their current, operations and how things are going?
Absolutely. There has been some questions that have been raised recently in the media as it relates to wait times. And as you'll recall, I think you actually asked that question previously, when the hospital did introduce the PEARL system, which is the electronic medical record system, that will prove efficiencies for all of Bermuda, because at one point or another we all will use the hospital. That PEARL, the overlay and the rollout of the PEARL system did see some hiccups insofar as staff of wait times, simply because staff needed to be trained on a computer system. It's a very, very extensive computer system, and we've anticipated that prior to the implementation and the rollout that there would have been some delays with respect to services, but we can assure you that those delays did not impact the quality of care that was delivered at the hospital.
Thank you. Turning to the Mangrove Bay Clinic that's going to be opened in the West End, $700,000 in capital funding towards that. Does the ministry currently have enough staff to service that center?
Thank you for that question. As you can appreciate, worldwide there are shortages of medical staff, and in particular nursing, and we are working through BHB as well as the Department of Immigration to try to secure more resources insofar as staffing and nurses. I read an article recently in the United Kingdom. They have in the NHS over 55,000 shortages of nurses. So it is a worldwide phenomenon, and we are working with immigration and our partners at BHB to address that. Regrettably, the beginning of the work will be this year, so we wouldn't be looking for additional staff until we roll it out next year when the completion of the contract work is completed. But in the interim, we are still working with immigration again to try to secure more nursing staffs here in Bermuda.
Okay. I guess I wanted to get to the reason why the center will be set up in Somerset specifically. Was there a location or reason for that location?
Well, in addition to the fact that Somerset is God's country and the holder of the cup match, the fact is that we already have Mangrove Bay, which is a facility in the Mangrove Bay area, and regrettably several years ago it became uninhabitable because of asbestos and the like, and then shifting finances and so forth for capital didn't allow us any expenditures to be made on the Mangrove Bay until this year. So we're very happy that that $700,000 has been earmarked so that we can continue the development, the plans and the like, so that we can have a first-class facility, medical facility in the West End, which, as I indicated in particular, it will provide a number of the services that are already at the Hamilton Clinic as well as the Lamfogo Clinic.
Okay. I wanted to get to the consultants for the universal health coverage. Do we have an update on that project? And I guess I wanted to sort of flesh out the reason for the consultants and the role that they'll be playing.
Okay, thank you, Jasmine. Regrettably, COVID put us back a little bit. Obviously, we were on the trajectory of trying to address universal health care, which is a platform and a throne speech initiative of the government. And it's very critical, and we need to ensure that we have the provision of health care for all individuals. We know one thing about COVID is that it highlighted some of the deficiencies that we have in the system as it relates to underinsured and uninsured individuals. We currently have a consultancy arrangement with KPMG, which are assisting with respect to the development of UHC. And I'm really pleased to know that in this budget, we will be able to establish a project management office which will help us to produce the work streams, the stakeholder engagements, and so forth, and help us move quicker towards universal health care, recognizing the 2.5-year delay due to COVID.
Okay. Looking at health insurance, some folks are paying, well exceeding their payroll tax. It's very expensive. Is this going to be evaluated to make it more affordable or to encourage less pressure on the system currently?
There is a lot of pressure on the system. Unfortunately, we spend over $770 million per year on our health system. Universal health coverage and the provision of that particular service is only one element. We have to deal with strengthening our healthcare system, strengthening our governance structure, ensuring that these silos are removed. It's a multi-task, multi-year engagement. USC is just a part of it. But in essence, as it relates to the insurance part, once we're able to roll out universal health coverage, it will be a premium and a plan that will be more affordable, that will address the needs of individuals, that will address things like consultancy fees and the like, caps and co-pays. But unfortunately, that is some time down the line. But that is what we're working. That is the direction of travel.
Okay. So in the short term, would you be open to giving employees other options to choose different insurance packages outside of their employee health insurance programs?
Well, that's legislated. Obviously, under the legislation, all persons that are employed are required to have some form of insurance. The government, as you can appreciate, does offer GEHI for former and current government employees. We also have the HIP plan as well as future care for our seniors. So in that regard, insurance is offered from the government's perspective, but then there's obviously insurance privately. But as it is a requirement under the legislation that all employers offer insurance to their employees, the reality is that as it relates to any type of increases in premium and the like, those are discussions that will be had, but it's all based on utilization, the cost of the particular services that are being involved, et cetera. But those are discussions that's not part of this particular budget plan.
Okay. And if I may, it's been covered in the courts recently. There are some inmates that are in need of care outside of the island. There's nothing locally that can be offered to them in terms of their psychiatric needs, but also their criminal background. Will there be any plans to assist in or look at other options outside of Bermuda?
Jasmine, under the Prisons Act, the persons that are responsible for providing any type of medical treatment to those persons that are currently incarcerated is the Commissioner of Prisons, which falls under the Ministry of National Security. So I'd invite you to ask that question to them.
Thank you. And just lastly, could you provide an update on locating an ENT specialist on the island? We currently haven't had one.
Yes, it's important to note that the ENT, as well as other types of particular specialists, with respect to the Ministry of Health, we're responsible for employing doctors within the public health sphere. Well, we've always encouraged persons or medical practitioners privately to look to employ EMTs. I understand that there, and I only know this because it was in the newspaper recently, that there is a local physician that has actually employed an EMT that is on island now.
Thank you.
Thank you, Jasmine. We'll now take questions from the Royal Gazette. Gareth?
Thank you. Good afternoon, Minister.
Good afternoon.
Yeah, just going back to this 322 million block grant.
Yes.
Can you tell me why that promise was never met by government, and how much was the shortfall each year, and what's the total shortfall over the last 4 years?
Okay, I don't know I don't have the numbers year by year, but the total shortfall is about 32 million. So this 15 million supplemental will help to basically cut that in half. However, when the block grant was first agreed in 2019, you may recall that in order to fund the hospital, it's made up of MRF transfers, a grant by the government, as well as subsidy, excuse me, that's paid for by taxpayers. Of that 322, unfortunately, year over year, there has been a shortfall that's been paid. And as the Premier indicated last week, it's regrettable that that was never honored on a year-by-year basis. We have to commend the hospital because they have done tremendous work and strides to reduce their overheads and their expenditures. So they've done their share, and I'm glad and pleased that the Cabinet has agreed to this $15 million supplemental, and the Premier also indicated, as you'll note, next year there will be an increase to BHB to help further put them on a financial sound footing.
Can you say how much that increase will be?
I don't. We'll ask the Minister of Finance.
Sure. Also in his budget statement last week, the Premier said that without further funding, our hospital would likely default on its government guaranteed debt. What would have happened if the board would have defaulted on that, and how much was government on the hook for relating to the PPP?
I don't know offhand. I want to say it's, I don't know, it's like 25 million a year is what has to be paid with respect to the ACW. But insofar as the total amount and what the default would have been, I don't have that figure in front of me, I'm afraid.
Okay.
It's certainly something that we would not want to entertain.
Sure. And the Premier has previously stated that on at least 3 occasions that he would release an unredacted copy of the hospital PPP, and he hasn't yet done so. Would you be willing to do that?
I can't comment as to whether or not, you're saying that that's what the Premier said, and I'm not really sure about that, and it was the unredacted PPP. I'd have to look into that further. That's the first I'm hearing about it, I'm afraid.
Okay. Just going back to medical tourism, and I know you said that the Minister of Tourism would be in a better position to address this question, but just looking at the economic recovery plan website, on the government's website, the economic recovery plan page, it states that interest and investigation into Bermuda medical tourism continue with an international private sector investor and consultant. Could you tell me who that investor and consultant is, bearing in mind that this was a project that was unveiled by government almost 2 years ago, March 2021, and it's kind of pretty much seems to have flatlined since then.
Right. I cannot provide that information because I don't know it. As it said in the budget statement, a stakeholders group has been put together to address that and to look into that further.
Yeah.
And no doubt the Minister of Finance and the Minister of Tourism would probably be better positioned to be able to provide that answer. If I said something, I'd be making it up out of my head.
We wouldn't want that.
No, not at all.
And just one final thing, going back to the Mangrove Bay Clinic, and I was just thinking along the same lines as Jasmine. It's the first thing that struck me with that is, Lanfogo is repeatedly having to reduce its services because of staffing shortages. Don't you think this is, I know, government is overstretching itself on this?
Not at all. If you live in the West End, then you'd probably fully appreciate the need for a clinic in that particular locality to service persons from Southampton and further west. As I indicated, there is a shortage worldwide of nurses, and we're hopeful that we'll be able to provide sufficient resources to the clinic. But at the end of the day, just like the persons in the East End are able to access a clinic that's within their geographical region, certainly the persons in Somerset and the West End would also appreciate that similar initiative.
Absolutely.
Thank you.
Thank you, Minister.
Thank you, Gareth. Thank you, Gareth. We will now hear from the Minister of Transport, the Honorable Wayne Furbert.
Good afternoon, everyone. I think it's very important that I at least correct one part that my colleague said. But the Hamilton Parish is the Bible Belt, and it's where Jesus lives. So we have to get that sorted out from the very beginning. But we're willing to correct that at any time. So I'm pleased today to provide highlights of the Ministry of Transport's 2023-24 budget, allocation and highlights for the fiscal year. The Ministry of Transport 2023-24 fiscal year budget is $72,352,000. This is an increase of $315,000 from the 2022-23 prior year budget. The departments within the Ministry of Transport are the Ministry of Headquarters, Department of Marine and Ports, Transportation Control, and Department of Public Transportation. The Ministry of Transport's estimate revenue for 2023-24 is $39,400,000, the bulk of which will be accounted for by the Transport Control Department fees. The Ministry Headquarters leads and manages the policy and strategic plans for the island's transport infrastructure and systems. The Ministry works closely with its departments, quangos, and external partners to ensure there is a collaborative effort in policy development. In recent months, the Ministry has worked jointly with the Bermuda Airport Authority, Bermuda Tourism Authority, and Skyport in an effort to increase air service to Bermuda. Air service development is a high priority for this government and for this ministry. Thus, 2023-24, the teams will continue to engage with all relevant stakeholders to increase air traffic to Bermuda. The ministry has built strong relationships with various cruise line partners. In 2023, the island can expect an historic increase in cruise arrivals, which will positively impact tax revenue and generate more visitor traffic to business at each port. We are approximately 220 cruise ships calls in 2023 compared to 164 in 2022, an increase of approximately 35%. The anticipated number of passengers for 2023 is approximately 622,000 compared to 402,000 in 2022, an increase of 54%. We started the cruise ship industry in April. Last year we had 23,000 passengers. In April we will have 70,000 passengers coming to Bermuda on cruises. This record cruise season will provide more funds to Government Consolidated Fund and the Bermuda Tourism Authority's budget to execute the National Tourism Plan. The Department of Marine and Ports is responsible for regulating and safely operating Bermuda's maritime affairs, including marine border security, search and rescue, and public transportation. The recently announced new and extended schedule for the Pink Ferry route signifies the dedication of the department to ensure the community receives the necessary transportation at the right place and at the right time. The funding allocated in 2023-24 for the new schedule will continue to provide passengers with increased travel flexibility during the week and weekends. With the increase in cruise calls this year, the department will require increased services and staffing. The department and the ministry are prepared to meet the demand and provide ferry service for visitors and residents. With the critical mission to assure the safety of all road users, the Transport Control Department, also known as TCD, will continue to oversee the operation of all motor vehicles and road users on Bermuda's road. The department will play a vital role in the development of zero-emission vehicle policy and Project RIDE initiative, which will better prepare our young people for safe road travel. One of TCD's remit is to oversight at locations where large visitor groups gather for transportation. With the increase in cruise passengers, TCD traffic control officers will coordinate and manage traffic in these high passenger volume locations across the island, and you can consider one of them as Horseshoe Bay. The Department of Marine Transportation, DPT, is an evolving department that has largely led Bermuda's zero-emission strategy. DPT launched its electric bus program in 2022 by successfully incorporating 30 buses into its fleet. These buses are operational and have received positive feedback from passengers and residents. DPT will continue the program in 2023 by purchasing an additional 40 electric buses due to arrive this summer. The electric buses provide many benefits to the public, including but not limited to environmental friendliness, healthier air quality for residents, reduced noise pollution, and reduced fuel costs to the government. During the 2023-24 fiscal year, the ministry will also be focused on key initiatives, such as upgrading infrastructure in Hamilton, at the Hamilton Ferry Terminal, and refits to our fast ferries, building new charging stations infrastructure to support recharging of buses, modernization of the public service vehicle sector. During this fiscal year, the Ministry of Transport prevailing mandate is to strengthen Bermuda transportation system to meet the current and future transportation services and products which reflect the government's dedication to our path to continue economic growth. Finally, I would like to thank the Ministry of Transport, committed and hard-working team, and all our partners who work in collaborative with the ministry to ensure we achieve the desired accomplishment for our country, Bermuda. Thank you.
We'll now take questions. Let's start with the Royal Gazette.
Thank you. Good afternoon, Minister. Just two questions. You mentioned electric buses. There are 40 more coming in this year. Is that coming out of this year's budget, or was that was that funded from last year's budget?
This year's budget.
So that's coming out of this year's budget.
Mm-hmm.
And could you say how much is going to be spent, A, on the electric buses, and B, on the infrastructure for those electric buses, with the recharging plants?
Yeah, so this year is $5,735,000. We did pay a down payment, was roughly about $1 million plus for this current year.
Okay, and that's for what, sorry? That's for...
So we paid roughly $1.7 million, I believe, for current 22-23.
Yeah.
We're paying another $5,735,000 in 23-24 budget.
That's for both the buses and for the infrastructure, or
just for the buses?
That's for the buses. And how much on infrastructure?
The infrastructure, I believe that was in this year's budget. I can't remember exactly what the amount is right now.
Okay. And are those electric buses, are they going to... are gasoline buses going to be phased out?
Yes.
So it's not going to increase the fleet at all?
No, the total amount of fleet will be actually about I think 100 ought to be, because it's 30 last year,
Yep.
40 this year, we're increasing it more as probably next year's budget.
Right. Okay, thank you. And one other question. You talked about increasing airlift, and obviously great news that we're getting so many more cruise ship visitors coming, but airlift is, or air arrivals are massively down on 2019. We're barely at halfway levels. Since your last announcement on this, what's been happening in the last couple of months? Have you been able to secure a route out of Boston?
Why did I know that question was coming? We have been aggressively working to ensure that we get some airlines here. And hopefully very soon we can make some announcement, but right now we're not willing to or able to do that right now.
Any idea when you might be able to?
As soon as we dot the I's and cross on the T's.
Oh, so you're pretty close.
After we dot the I's and cross the T's.
Thank you, Minister.
Thank you, Gareth. Jasmine?
Hello, Mister. How are you?
Hey, Jasmine.
So you mentioned there that you're aggressively searching for options to create airlift direct to Boston. Now, my understanding is that a lot of these negotiations are based on hotel beds and availability. How would you describe that relationship between airlift and hotel capacity, and where are we at with it? How would you describe it?
Well, there's a comparison between the amount of beds we have and also as far as airlift concerned. Most people have been pushing for some type of flight coming out of Boston for medical reasons also. And so we are working hard to try to find and aggressively trying to make something happen for the winter season. And so we have some further lifts coming out of I believe LaGuardia. JetBlue is coming out of LaGuardia. Sorry, we have American coming out of New York, and we have United coming out of Newark. So there has been some increase in airflows for this year, and hopefully we can get some more. As I've said before, I've been disappointed about the Miami flight, surprise to us, but we will work hard to make something sure, well, I'm saying sure, but try to make sure that we get something done there also.
Yeah. I guess there's some people feel a little confused when they see, record flights going to the Caribbean, but that's not reflected here in Bermuda, yet we offer somewhat of a similar product. How do you...
Yeah, they have more beds too, and that's what I'm saying. There's a balance between beds and airlifts. If we have more beds, of course, there'd be probably more airlift coming out of that area. And so, as you know, the government is working hard to, and you just heard, I think it was yesterday, a couple of days ago, where a particular hotel announced that they hope to start digging very soon. So if that takes place and happens next year, then that's another 1,000 or whatever availability. Then we're looking at Bermuda Anna. There's also development up there in South Shore, up there where the I think it's Ward gas station is in the area. So there are some positive things happening. And so, yeah, we hope that at the end of the day, the airlines will see that and make sure that things Southwest talk to me about once we can see them things happening, they can see us talking.
Okay, thank you. So record historic numbers of cruise arrivals. You mentioned that in your statement. Typically, cruise visitors don't spend as much here on island. Are there plans to perhaps encourage more spending, investment in products that we can offer them?
Greatly, we'd love to make that happen and try to encourage, and that means that the retail stores and those who are involved in producing products will be able to go there and make it happen. But you can see the benefits from the government consolidated fund. I believe last year we did about, I'm taking a guess right now, $20 million in revenue from passenger tax. This year we do roughly about $30 million, so that kind of helped out with our budget. The BTA will get additional funding this year, mainly coming out of there. So there are some benefits coming out of that, and they do spend not just as airlines, and that's worldwide. People get off the ship. I'm an avid cruiser, and I probably don't spend as much if I was in a hotel.
Sure. As it was mentioned in the House of Assembly, your colleague mentioned that transport, it comes out on top as one of the chief concerns that visitors experience while they're here. Do you have an update on how talks are going with taxi reform to that industry?
Yeah, we're having some great discussions with them. And hopefully we can make an announcement soon on how because there's some transportation challenges. And I don't mind telling yourselves that we found out when we got there that 81 taxis were off the road. And I just found that kind of, so we have 600 taxi permits. 81 was off the road for one reason or other, probate. And they're challenged because husband or daughter and sons may be fighting over the asset. There's a challenge in that way, legal battles. And then we have taxi drivers who particularly work for the insurance business, and that's all they work for. And then we have the other challenge maybe with many people who are working for government or other departments or other stores who may be just doing part-time at nighttime. So we have some challenge there, and we're working with them, and hopefully we can make an announcement on how we hope to correct some of this.
Okay, thank you. And just lastly, the Road Safety Council's called for more resources to help them with funding research to find legal means to deter poor driving habits. Some people feel that the deterrents aren't working. An 18-month disqualification and a fine of over $1,000 for drunk driving is just not, changing people's behavior. Would you support increase resources for them?
We've increased from 50 to 80,000. So they got an additional 30,000 in this budget.
Okay. And how are you hoping that that'll be spent?
Well, that's up to the committee, and they've asked for it to be given to them.
Okay. And would you call for legal reform to deter poor driving habits?
What's the question again?
Changes to law to make penalties increased for poor driving habits.
We have always the opportunity to look at legislation, see what we can make some changes. Some behaviors will never change, but if we can find some type of law or legal aspect to make it work, then we will look at it.
Thank you.
Thank you very much. Thank you, Roy Lizette, and thank you, Zediam, for coming. That concludes our press conference.
Thank you.
Ministers.